Hi friends, welcome back to my YouTube channel. So first of all, please subscribe to my YouTube channel. Then coming back to our today's topic is atypical wound care is the part of integumentary system. So in this video, we will talk about scleroderma, vasculitis, management of wound and its treatment. So let's start the video. Atypical wound care. Wounds due to the uncommon etiology called atypical wounds, less frequently encountered and less well understood. The most commonly encountered etiologies for an atypical wound include inflammatory processes, number 2 infections, traumatic and metabolic disorders, genetical diseases and malignancies. So we have to really care about these etiological factors. Atypical wounds critical to recognize. A wound should be evaluated for an atypical etiology if present in location different from that common chronic wound. Appearance vary from that common chronic wound, does not respond to conventional therapy. Tissue sample are mandatory for atypical wounds because many of unusual causes of wounds can resemble each other. Critical for histological evaluation and tissue culture and immunoforensic testing. The risk factors. The risk factors for typical wounds is usually higher in elders, people with weak immune systems, and is associated with pre-existing chronic medical illness, infections, inflammations, or tumors. Taking many prescribed medications and leading to unhealthy lifestyle can also increase the risk for developing atypical wounds. So these are the risk factors that affecting and causing the atypical wounds. What are the potential etiologies? Number 1 is inflammatory vasculitis, pyoderma gangrenosum. Infectious atypical mycobacterium, deep fungal infection, malignancies in which squamous cell carcinoma, basal cell carcinoma, and lymphoma. Metabolic and genetical causes. What is scleroderma? A widespread connective tissue disease that involves changes in the skin, blood vessels, and muscles and internal organs. That we are seen in this diagram. As we are seen in the diagram, there is the changes of skin in hands and also in legs. So we can say it scleroderma. Now vasculitis, inflammation and necrosis of blood vessels which can ultimately result in end organ damage, kidney, lung, CNS and GIT. Immune complexes, antibody antigen deposited in blood vessels walls and cause many type of vasculitis, often idiopathic, may be get triggered by certain reactant infection, malignancy, medication and connective tissue diseases. If identified and if possible, causative agents should be addressed. So these are the vasculitis condition. Now the third topic of atypical wound is pyoderma gangrenosum, an inflammatory process of unknown etiology that lead to painful skin ulcer, disorder that is neither infectious or non-gangrenous. Reoccurring destructive ulcers which begin as pustules and resolve with cumbery-form scars. It is associated with systematic diseases in more than 50% of patients. Inflammatory bowel diseases, hematological abnormalities, immunological abnormalities. So these are the conditions that we are seeing in pyoderma gangrenosum because there is inflammatory process of unknown etiology that lead to painful skin ulcers. Now moving forward toward atypical mycobacterium infections, cutaneous infection results from exogenous ingredient and predisposing factor, trauma, immunosuppression, and chronic diseases. Number 1 is deep fungal infection that we are seeing in mycobacterium infection. And the second one is calciphylaxis, a rare, often fatal condition that is characterized clinically by progressive cutaneous necrosis, which frequently occur in patients with end-stage renal diseases, most commonly linking phenomena developing of secondary hyperparathyroidism. What are the causes in this? Causes elevated calcium phosphate product, calcification, vascular, cutaneous and subcutaneous to tissue death, forming cell necrosis. Now the next one is malignancies. Malignancies may present either as wounds developing from wounds, non-melanoma, skin cancer, lymphoma and sarcomas may ulcerate as they outgrow their blood supply. Alternatively, chronic wounds may develop into a malignancy, squamous cell, most commonly basal cell carcinomas. This phenomenon is termed as Marjolin's ulcer, an occurrence that can be seen up to 2% of chronic wound. Similar phenomena may also occur in scars, burn wounds, sinus stacks, chronic osteomyelitis, and even vaccination sites. And external causes in atypical wound is spider bites, chemical injury, burns, chronic radiation exposure, trauma. Through patient history, most valuable tool in determining the etiological agent in ulcer caused by external factors. So these are the main causes that affect the any wound. What are the aim of wound care? The aim is number one, encourage wound healing, which is the most important of any kind of wound care. Number two, maintain daily activities. Number three, social acceptability. So these 3 points are the main wound care aims. Now, wound management, treating the underlying cause when possible. Number one, pain management. Number two, anti-infective agents for infectious ulcer. Malignancies may require surgical removal and anti-inflammatory agents for inflammatory ulcers. Number third is moist healing environment, compression dressing for leg ligaments in absence of artificial sufficiency, offloading areas at risk for prolonged pressure, and maximizing patient nutritional status are essential. Then the next point is necrotic tissue. Surgical debridement is contraindicated as it may result in even worse ulceration. Debridement and skin grafting considered when condition is under control. Number third is avoidance of trauma at dressing removal. Disturbance can generate an even greater inflammatory response and stimulate deteriorations. Despite these measures, healing is often slow in patients with atypical wounds. Prolonged healing leads to number one, increased morbidity. Number two, decreased quality of life. Number three, increase in direct and indirect cost of care. So these are the three leads of these points in atypical wounds. So here's today's lecture. I hope you guys like the video and please share with your medical friend. Thanks for watching.